Munchausen syndrome by proxy is one of the most disturbing forms of factitious disorder documented in clinical psychiatry. It is a condition in which a caregiver, most often a parent, deliberately fabricates, exaggerates, or induces medical symptoms in another person, typically a child, to gain attention, sympathy, or control over medical personnel and social systems. The harm is real. The deception is intentional. The psychological motivation is complex, rooted in the caregiver's own mental health struggles. This presentation explains how Munchausen syndrome by proxy forms, the psychological and behavioral mechanisms behind it, and the clinical challenges it presents. All information is drawn from peer-reviewed literature, case studies, and forensic psychiatric documentation. Section 1. The core mechanism. Human caregiving instincts are powerful and deeply ingrained. Parents and caregivers are neurologically wired to protect, nurture, and respond to the needs of dependents. Munchausen syndrome by proxy exploits this instinct by deliberately manipulating medical perception. The caregiver presents the child as repeatedly ill or injured, creating a narrative of chronic medical vulnerability. This is achieved through fabricated verbal reports, tampering with medications, or the direct induction of illness through poisoning, suffocation, or other harmful methods. These actions are not accidental, impulsive, or negligent. They are intentional, calculated, and sustained over time. The caregiver's primary motivation is psychological gratification, most often derived from attention, admiration, sympathy, or the illusion of control within medical and social systems. Section 2. Development and onset. Munchausen syndrome by proxy typically emerges from a complex interplay of psychological, familial, and, in some cases, sociocultural factors. Caregivers who develop this behavior often exhibit identifiable risk markers, including a personal history of medical trauma, prior factitious disorders, or underlying personality pathology, most commonly borderline or narcissistic traits. A chronic need for attention, validation, or perceived significance is frequently present. Onset usually occurs during the early childhood of the dependent, when vulnerability is highest and autonomy is minimal. Over time, the caregiver establishes repetitive patterns of medical visits, diagnostic testing, and intervention-seeking behaviors. These patterns are reinforced by external attention and can persist consistently for months or even years. Section 3. Behavioral patterns. Caregivers with Munchausen syndrome by proxy exhibit a set of consistent and identifiable behavioral patterns. These often include frequent and recurrent hospital visits for the dependent, accompanied by an unusually detailed level of medical knowledge that exceeds what is typical for most caregivers. Reported symptoms frequently fail to align with clinical findings, creating diagnostic confusion. The caregiver may resist discharge, express dissatisfaction with improvement, or demonstrate a preference for prolonged hospitalization and continued testing. Externally, they often appear excessively attentive, cooperative, and engaged with medical staff. This outward presentation of concern and compassion serves to obscure the intentional induction or exaggeration of illness occurring simultaneously. Section 4. Victim impact. The victim, most often a child, experiences severe and potentially life-threatening consequences as a result of Munchausen syndrome by proxy. These include repeated medical procedures, prolonged exposure to unnecessary medications or interventions, and direct physical injury caused by the deliberate induction of illness. Beyond physical harm, the child is subjected to significant emotional and psychological trauma arising from inconsistent caregiving, repeated hospitalizations, and chronic medical uncertainty. Over time, this can lead to deep-seated distrust toward caregivers and medical professionals. These harms are entirely involuntary. The child lacks both the capacity to recognize the deception and the ability to resist it. Physical and psychological damage frequently persists long after the abuse is identified and intervention occurs. Section 5. Psychological dynamics of the perpetrator. The psychological motivation driving caregivers who engage in Munchausen syndrome by proxy is complex and multifaceted. Central to the behavior is a persistent desire for attention, sympathy, and validation, particularly from medical professionals. Many perpetrators experience a heightened sense of control through influencing diagnoses, treatments, and medical outcomes. This behavior is further reinforced by positive feedback from hospital staff, extended care teams, and expressions of concern from the surrounding community. Internal gratification is often derived from the perceived role of the devoted, heroic caregiver. In most cases, Munchausen syndrome by proxy is not motivated by financial gain, nor is it driven by overt hostility or conscious malice toward the child. Instead, it reflects a pathological need for recognition, validation, and sustained psychological reinforcement. Section 6. Neurological and Behavioral Observations. Research examining caregivers involved in Munchausen syndrome by proxy indicates a pattern of neurological and behavioral irregularities. These may include heightened anxiety, persistent hypervigilance, and an exaggerated dopamine response to attention, recognition, or perceived validation from others. Some findings suggest dysregulation within empathy-related neural pathways, allowing the caregiver to inflict harm without the typical affective distress associated with causing suffering. Victims, in contrast, often exhibit pronounced stress responses during medical procedures, confusion regarding the true source of their illness, and paradoxically strong emotional attachment to the caregiver despite ongoing trauma. This attachment can be reinforced by dependency, fear, and repeated reinforcement of the caregiver as the primary source of safety. Together, these observations highlight the complex and deeply intertwined psychological dynamics between perpetrator behavior and victim response. Section 7. Risk Factors and Identification. Munchausen syndrome by proxy is more likely to occur under specific conditions that increase both vulnerability and opportunity. Risk is elevated when the dependent is young, medically fragile, or unable to communicate effectively. The disorder is more frequently observed when the caregiver has significant and repeated access to medical systems, combined with social isolation from extended family, community oversight, or external support structures. A documented history of factitious behavior, compulsive patterns, or prior unexplained medical narratives in the caregiver further increases risk. Identification of Munchausen syndrome by proxy requires careful, methodical monitoring and a multidisciplinary investigative approach involving medical professionals, mental health specialists, and safeguarding authorities. Suspicion is often raised when symptom reports are inconsistent with clinical findings, diagnostic tests repeatedly return normal results, or the dependent's condition improves markedly during periods of separation from the caregiver. Section 8. Associated Conditions. Munchausen syndrome by proxy frequently coexists with other psychological conditions that complicate both diagnosis and intervention. Caregivers may also meet criteria for factitious disorder imposed on self, reflecting a broader pattern of illness fabrication and attention-seeking behavior. Personality pathology is common, particularly borderline, narcissistic, or antisocial traits, which may influence emotional regulation, interpersonal manipulation, and empathy processing. Depression and anxiety are also frequently present in the perpetrator, either as pre-existing conditions or as states reinforced by ongoing behavioral cycles. Beyond the primary victim, secondary trauma is often observed in siblings and other family members who are exposed to chronic medical crises and psychological instability. This layered comorbidity significantly complicates recognition, treatment, and long-term management. Section 9. Behavioral Case Studies. Documented clinical case studies illustrate the severity and scope of Munchausen syndrome by proxy. In many cases, children are repeatedly hospitalized for symptoms such as persistent fevers, unexplained seizures, or chronic medical complaints that later prove to be fabricated. Some cases involve the deliberate induction of illness through hypoglycemia, poisoning, suffocation, or interference with medical treatments by the caregiver. A recurring pattern is the reporting of false or exaggerated symptoms to multiple physicians across different institutions, often resulting in extensive testing and unnecessary interventions. A critical diagnostic indicator across documented cases is the child's marked improvement in health when separated from the caregiver. In each situation, medical professionals must carefully balance immediate child protection with thorough, evidence-based investigation to prevent misdiagnosis while ensuring further harm is avoided. Section 10. Clinical Management. Effective treatment and intervention for Munchausen syndrome by proxy focus on both protecting the victim and addressing the underlying pathology of the caregiver. In suspected cases, immediate separation of the child from the perpetrator is critical to prevent further harm. Management requires a coordinated, multidisciplinary evaluation involving pediatrics, psychiatry, social services, and, when necessary, legal authorities to ensure child protection. Psychological treatment for the caregiver is essential and typically includes therapy targeting underlying factitious behaviors and personality disorders. Simultaneously, the child requires supportive therapy designed to address trauma, restore trust, and reinforce safety. Throughout intervention, care must be taken to maintain strict confidentiality, prevent re-traumatization, and ensure ongoing monitoring to safeguard the child's well-being and prevent recurrence. Section 11. Final Summary. Munchausen syndrome by proxy is a severe psychiatric disorder in which a caregiver deliberately harms, exaggerates, or fabricates illness in a dependent to gain attention, sympathy, or a sense of control. This behavior is intentional, repetitive, and psychologically motivated. It is neither accidental nor the result of negligence. Victims endure real physical and emotional consequences, often with effects that persist long after the abuse is discovered. The caregiver's pathological psychological needs are the driving force behind these actions, which can continue without timely intervention. Understanding Munchausen syndrome by proxy is essential for medical professionals, social workers, and psychologists to prevent further harm, protect vulnerable children, and implement effective clinical treatment. The disorder highlights the complex intersection of mental illness, caregiving, and the mechanisms of attention-seeking and control. You've just heard one more fragment of how unstable, unpredictable, and fragile the human mind really is. If this case or this disorder changed the way you look at people, that means you're finally seeing what most can't see. New files will be opened soon. More cases. More disorders. More cracks in the human psyche. Until then, stay observant. And if you want more cases, you know what to do. Remember, observation is survival.